Is we want to go live and we just want to share our views and experiences about hijama or cupping. Some people say it cupping, some people say it wet cupping, some people say it hijama. So I must tell you the what is cupping and what is hijama. Hijama is an Arabic word which is derived from the Central Asia, and wet cupping it's an English name or cupping. There are many types of cupping. Like I must tell you the cupping types of cupping. That is one type of cupping, that is fire cupping. Normally people does it in China. That is a fire cupping, and one more type, that the cupping, that is dry cupping, and one more type of cupping, that is wet cupping, with which we withdraw some blood from the body. So these are the basic three types of cupping, right? If we talk about the fire cupping, how it helps and what is that, fire cups we use normally nowadays, we use glasses. It's a glass made of a cup. So I just a minute, I'll get that cup and I'll show you. Can you get me that cup? So glass cup, I'll show you how it looks. That glass cup. So basically, what we do, we apply some oil on the skin. We apply on the some skin oil, and then we give some kind of a fire inside that cup very fast and put it on the skin. Either we can put it on the skin and keep it there for 10 minutes, 15 minutes, depends on the patient, and it depends on the requirement of a patient. Or one more thing, either way, what we can do, either we can put cup and then give kind of a massage with that slow massage, right? That is another. Another which we have added, that is called, we call it as dynamic active cupping, in which what we do cupping, we move the cups, that those glass cups, and with that, what we do, we also used to say patients just to move your body, like if we do it for if we are doing for knee pain, so we are doing it on IT mat. So patient does knee flexion extension, like same, or sometimes we do it on the quadricep muscle, we say flexion and extension and prone push, spine push, right? So this is called fire cupping. And another one is same, that is wet cupping. We use cups with the help of a section. So I just want to show you, this is a cup we use. This is a cup we use in dry cupping or in wet cupping. So this is basically a plastic fiber cup. um, I'm gonna show you, this is a fiber cup, and we make a suction and put it on the body, and then make a vacuum. And another type of a cup, that is a glass cup. Glass cup we have here, and I'll just show you how to just get that cup, glass cup. That's called a glass cup. So just in a second, I just big one, get a big one. So we have a another kind of a cup, that is a fire cup, that is made up of a glass. So we use that for fire cupping, and this we use for the dry cupping or wet cupping. But in dry cupping and wet cupping, what is it? I'll show you just this. This is my gun. I'll show you. So this is the gun we use for the suction. There are two types of suction we can make by two types. Either we can make it with the gun, or we have a machine, vacuum machine. With that we can make. Like for example, I'll put a cup like here and make. I'll do it like this, and this is got, see, it's a vacuum. So this is it. If I'm just waiting, people will come and watch, and they can ask me questions so that I can give them an answer online here. But I must tell you, the best way of cupping, that is wet cupping or hijama. That's the best in all cuppings. And in that, what we do, we withdraw some blood from the body. We have always a limitation of withdrawal of blood. Right, and in the meanwhile, I'm just telling you some, I'm getting some, queries. Some one of my patient, he's asking me, can we do it on face? So I must tell you, we do not use on face, because if we give minute cuts on the skin of the face, it's a very sensitive. We can get scars on the skin. So better to avoid skin. We should not go for a face. We can use on head, we can use on upper back, lower back, wherever you want, but except this area. And we should always remember, we should avoid arteries where there's a arteries, like if one of the book which is actually written by Chinese and is translated one of the Indian or Pakistani author. He has given a point in between first and second metatarsal, which is I believe wrong. It should be second and third. So there are many type of mistakes. So we should be very careful while reading all the books or texts. So if we talk about bed cupping, in which condition it helps in it helps. If I start from the head, it helps in hair fall, hair control. I'm just also going for a hair fall. I'm so losing hair, my hairs. That's why I'm losing. So we are just going to. I'm also going for that cupping. And I must tell you that it helps in depression. It helps in cold. Some people, patient, they have a DNS, derived nasal sputum, rhinitis, and some people they have depression, insomnia, a hair fall, a hair growth. On which in these conditions we does it on hair. I mean on head. And some other kinds like for neck pain, cervical spondylitis, or cervical spondylosis, spondylolisthesis. These are many, and radiculopathy in the right or left. We does on cervical area, right? Cervical and upper back. And after that, we have more like we does it for the hyperthyroidism, hyperthyroid, and we do it on all. We do it for kidney problems, for gastric. And irritable bowel syndrome. We do it for erectile dysfunction, premature ejaculation, infertility conditions. We do it for the back pain, right? And for the osteoarthritis and many more. So I am just waiting because this is my first time. I don't have any experience to going on online. So that's why I don't know how to make exactly the online videos. Uh, so I'm just waiting if somebody can ask me question, or so that I can answer them online. Apart from that, what we do, we are having a sports physiotherapy clinic in Delhi, Saket, where we have a very good result in knee pain, especially if you are suffering from any kind of a knee pain. We can help you out as well. I'm having specialization in sports physiotherapy, especially in ankle and knee. So we do it very good. So it was just a small experience of making video online, going online. So next time I'll make sure I'll make a video, good video, and with good voice quality. Thank you. Thank for watching. Somebody is watching me. Thanks.